Hello everyone, and welcome to this audio podcast. This audio podcast today, as part of the Serology and Squil. This audio podcast is part of the Hustle and Serotype. This audio podcast is part of a Defcon premiere, and this audio podcast is part of a Storm Robotics production. Continuing on and looking at IST pharmacotherapeutics and AAR. So the monoclonal antibody basiliximab, sort of one of the older generation MAB monoclonal antibodies, is a glycoprotein obtained from a fermentation of an established mouse myeloma cell line, genetically engineered to express plasmids containing the human heavy chain and light chain contrast region genes, and sort of the mouse heavy and light variable region genes encoding RFT5 antibody that binds selectively to the interleukin 2 receptor alpha. Investigations have demonstrated in a randomized trial that recruited 348 patients, two demographically matched and equally sized cohorts treated with either basiliximab and or placebo. A dose of basiliximab at 20 mg infusion on day 0 and day 4 were selected to block the detection of IL-2 receptor on 97% of peripheral blood lymphocytes for 30 to 45 days. All recipients have received IST pharmacotherapeutics with mainstem IST, that being the older generation CSA or cyclosporin A microemulsion, and the formulation being the formulation of CSA being Noral, and additionally sort of corticosteroids. An intent to treat analysis of 1 year data assessed the incidence of post-transplant AAR episodes and patient and graft survival prognosis and safety profile of basiliximab were also documented. Investigators had informed that the prophylactic basiliximab IST is and was well tolerated and had achieved and had an adverse event profile comparable to placebo, but also reduces the number of AAR episodes in renal allografted recipients significantly within the first year post transplantation. In other earlier clinical works, investigators looked at the safety and efficacy of basiliximab in patients or recipients who had received live-related transplants in 1 year. In live-related transplants in one center. And the researchers recruited 100 adult recipients receiving the first transplant from first solid organ transplant from a living related donor between in around June 1998 and June 1999. And recipients were prospectively randomized into treatment cohorts, one to receive basiliximab and the second as a control. Basiliximab was introduced intravenously in two doses of 20 mg each at the first 2 hours preoperatively, and the second on day 4 post transplant. Corticosteroids again were administered by intravenous infusion, and 500 mg of being that of 500 mg on the day of transplantation, being day 0, and 250 mg on a following day, followed by oral gradual increments of the corticosteroid. The trial also established established that the neural formulation as a base therapy or pharmacotherapy, which started 2 days before transplantation, and then divided into 2 doses according to the to whole blood trough levels, was or had been had been had been had been had been had been achieved applicable sort of whole blood trough levels in context of of um, of in around pharmacotherapeutics. So that draws this audio podcast to a close. This audio podcast as part of a serology and Squil. This audio podcast as part of the Hustle and Serotype. This audio podcast as part of a Defcon premiere, and this audio podcast as part of a Storm Robotics production.